Thank you for joining us today on this special Facebook Live. My name's Charlie and I'm here hosting with Dan Howarth, who is our Head of Care and a Diabetes Specialist Nurse. We're going to be spending the next 35 to 45 minutes just answering some of your questions. I know some of you have sent a few questions in already, and thank you for doing that. And we're going to just take the opportunity to answer some of the questions that you've shared with us, give you the opportunity to ask questions live. You've got us, as I say, for the next 30 to 45 minutes. And if we don't get to any of your questions during this live Q&A, we will, of course, come back to you as soon as we can to answer any other questions you may have. We understand, of course, this is a really unusual and challenging situation. So it's really important to us that we're able to address some of the questions and concerns you might have and yeah, really just understand what your worries are and see how we can help. So without further ado, thank you again for everyone who's sent some questions in already. We're going to kick right off, Dan, if that's all right with you.
Yeah, absolutely. Welcome, everybody.
Yeah, thank you for joining us all. So we've had a couple of questions from you all about shielding and the letters that you were hoping to receive from the NHS, or expecting to receive from the NHS. And some of the questions you've been asking us are why people with diabetes who have no complications did receive the NHS letter and others didn't, and why some over 70s with underlying health conditions, including diabetes or chronic kidney disease, who are in the high risk group and were originally told to isolate for 12 weeks, are now not included in the shielding group and therefore not receiving a letter from the government. So, Dan, do you think you might be able to just provide clarity there for people watching at home about the distinctions between those groups and why some people may have expected to receive a letter and didn't?
Yeah, and I think that you're right, there has been an awful lot of confusion and lots of people have been getting in touch with us constantly about this particular issue. And I think that really where it stems from is right back at the very start of this, when the government initially went out and said people need to work from home, and that in the future, potentially, all those people that receive the free flu jab might need to stay at home for 12 weeks. And although they didn't say the word shielding at the time, that's what they were kind of insinuating. So a lot of people with diabetes, myself included, as I have type 1 diabetes, started to think, oh, that's what's going to happen for us. But actually, when the government advice came out, people with diabetes, because of their diabetes alone, and that's really important, don't need to shield solely because of this diabetes. Now, I believe that there's some GPs that have taken that initial very, very first, if you need a free flu jab kind of information, and started to get prepared and sent out letters already. And we know we've spoken to our colleagues at various different royal colleges, and they are stating that they are still in line with government advice. So the government advice is that if it's diabetes alone, then you won't necessarily need to shield. This is also done, though, by your GP or your diabetes team, your health professional. It's their discretion. We know that there's so many different individuality to take into account in diabetes. So if someone, for example, in the question, I think they said about type 1 and having no complications, then your GP or your diabetes team will have looked at your history and decided that actually it's a really good idea for you to shield, alongside those people that receive the letter from the government who are in the 1.5 million. So those 1.5 million are people that have got various different cancers, different high-risk infection conditions, and some of those people will still have diabetes. So there's a lot of people that have got kidney problems and have diabetes, and it's the kidney problems that's really putting them into that shielding group. So we've been looking at an awful lot into this, and we've been really asking the government, we've been asking the NHS rather, to look at the data to see whether people with diabetes need to be shielded. And right at the minute, as of today, there is nothing that says that people based on diabetes alone need to shield. So there's an awful lot of information in there, and it is a very confusing kind of information, but hopefully that's cleared up a little bit. Is that all right, Charlie? Have I answered a little bit, do you think?
Dan, what should people do if they think they should be in the shielding group but haven't received the letter?
Absolutely. If you think you should be in the shielding and have had a letter, then you could start shielding. You're not going to get fined if you're shielding and you shouldn't be. but speak to your GP. It's one of these things that you really need to get in touch with your own individual doctor and say, I need to be shielding because of X, Y, and Z. You know, chances are they might say, yeah, you've just fallen through the and we're really sorry, or actually, you don't really need to. You just need to stringently social distance like the rest of the population. So speak to your GP. You can also get assistance, and I'll be talking a little bit maybe about the assistance that you get from 111. So the 111 website, that's for people in England, can go to the 111 website and put in their conditions, and that will give you a letter that will support various different things. So getting some extra help with pharmacy deliveries, for example. I think there's a question on that coming up a little bit later on, so listen out for that.
So thanks, Dan. And it's worth saying that, as I said, we will go through all of the questions you're asking us on the live stream today, and we'll come back to all of you with those questions. It's also worth saying that the most up-to-date information we have currently available to us can be found on our website, which is diabetes.org.uk/coronavirus. So a couple of people got in touch over the weekend letting us know they've been finding it more difficult than usual to manage their blood sugar levels at home at the moment. So one of the questions that we had, Dan, was that reading the research, it seems that high blood sugars are a possible trigger for lung debilitation. What practical advice can you give to people with type 1s to drastically deal with or reduce that trigger?
Okay. Just need to cough. Excuse me. Thank you. There's a really, really, really good question. So the research at the minute, particularly pertaining to COVID-19, isn't that great in any aspect of COVID-19 management. It's very, very small. Obviously, it's still this very new. We've only really known about it for 5 or so months. So studies haven't really been that effective. So of the published data, doesn't really indicate about very high blood sugar. And the question talks about high blood sugars. High blood sugars we can really look at in two senses. The first could be the high blood sugar that you randomly get, or that you get a high blood sugar during the day. Now, that definitely isn't going to be a particular for the lung debilitation, as mentioned in the that one-off high blood sugar, because you know you've not taken your insulin on time, you've got to take some tablets this morning, or the piece of food that you were eating was a bit more carborific than you thought it might. That won't be the thing that causes what someone's described as the trigger. High blood sugars over a longer period of time, which we know, and out there will know, relates to your overall diabetes control, your HbA1c, then having a higher HbA1c does put you at risk of certain infections. It puts you at risk of dealing with those certain infections. When there's a lot of sugar in your blood for a lot of the time, it gets a little bit thick and sticky like syrup. So it might not be flowing to the parts of the body that you need it to. And also those cells that go and attack infections are white blood cells. They're kind of like your home guard of your body. So they'll be going and trying to find the bad stuff in your body and get rid of it. But if there's a lot of other things, namely sugar, in your blood, then it doesn't really have an effective way of doing that. So it can be quite challenging. So there's a little bit of a mixture there. Practical advice is do what you keep doing and do it really well. Basically, you know, if you've got type 1 diabetes and you want some advice about lowering your blood sugars, think about your medication management, your exercise, and the types of food that you're eating. And there's loads of information on that on our website, diabetes.org.uk.
Great, thank you, Dan. We had another question sent through over the weekend, which says, I'm struggling to keep my blood sugars down overnight. I have a Libra, so I know I'm not having hypos and releasing glucose to compensate. I thought I might be experiencing the dawn effect, but taking more insulin overnight makes my blood sugars go up. What's going on?
Taking more, the question again, sorry, Charlie, says taking more insulin overnight makes my blood sugar go up, not down.
Yes.
Oh, interesting. Okay. Well, as with the first question as well, I just want to reiterate that you're right. It is at the minute it's a very strange for a lot of us. So a lot of us will have to start looking at the way our diabetes is managed in order to make compensation for what's going on at the minute, whether that's just the types of food doing, the lack of exercise, the environment, the worry, stress, and so on and so forth. So both questions are really, really good, and I think will help a lot of people out there. Now, unfortunately, I can't make an absolute individual advice, particularly on this question. The person that asked the question, I'm really, really grateful of it. But I would have more information if I was seeing you in a clinic and had access to your notes and so on and so forth. There's a few things that we would have to look into. Don't say so. You've got a Libra, so you know that you're not going low, and you mentioned about the dawn effect, which is where your body will release a load of sugar, which is what gives you that high in the morning. Overnight blood sugar are really important, and the question kind of states that. We're really looking at your overnight insulin and whether you keep things stable or not. Now, if you go to bed on a blood sugar of, say, 8, and you wake up in the morning with a blood sugar of 8, that's very stable. It's wonderful. It's really good. If you go to bed on a blood sugar of 15 and you wake up with a blood sugar of 15, again, although they're not good numbers, or they're not great numbers, it means that the blood sugar is probably quite stable. So looking at what you're doing before you go to bed, how long before you eat, have you had enough insulin for that food that's going to carry on whilst you're asleep, potentially? The kind of exercise and things that you do during the day, slow releasing carbohydrates might make your blood sugars rise a little bit later on. But it sounds like you're doing the right thing of monitoring. Having that flash makes it a little bit easier. I think that taking that extra insulin, I'd have a little bit of a look at the kind of insulin that you're taking, as that would be slightly different. The time that you take it as well, and whereabouts you're injecting that insulin also. That might alter the way that it's being absorbed. Your diabetes nurse, if you've got, I'm guessing that you have a diabetes nurse, or your is still available. In some places, they are restricted so that there might be only one person that's answering the phone. Still get in touch with them if you're having struggles like this. We need that extra bit of help from someone that get in touch with them. The NHS is still open, as we keep on hearing.
Great, thank you, Dan. We were asked over the weekend, I'm struggling to control my blood sugars. They can go from very high, over 20, to very low in the same day most days. Why is this when I usually have good control?
Really good question. So a couple of things I would want to look at. Again, if you were here in front of me now or in my clinic, I would be able to kind of go into a bit more detail. But very, very high blood sugars followed by very, very low blood sugars, if you kind of think that it's going like that, peaks and troughs, that can be a sign your injection sites may not be as 100% perfect as they could be. So we often refer to them as lumps and bumps, but the technical word is the lipodystrophy, or in some cases hyperlipodystrophy. And that's from injecting into the same place all the time. And you may think that your injection site is good because you don't feel any pain there. And that's because these lumps and bumps actually cover the nerves. So in our head, we think, oh, I'm going to keep going there. Have a little look at your injection site. If you run your fingers over them in a flat way, or in a kind of like a Boy Scout kind of way, run them over your skin like that, just gently stroke. Obviously, you won't be injecting to your forearm. Let me just point that out. I just don't want to get my stomach out on camera. But if you run your fingers over that, if you feel a little marble, a kind of marble underneath your skin, then that can be a sign that you need to avoid that area. Very high blood sugars followed by very low blood sugars is an absolute classic symptom of the lumps and bumps. So have a little look. The other thing that could be going on for you, and another thing to look at if you think, oh, Dan's wrong, perfect injection sites, that's very good, is are you overcompensating with your corrective doses? Or are you doing something that we call stacking your insulin, which means taking a dose of insulin at, say, 5 o'clock in the evening, testing your blood sugar and seeing that your blood sugar hasn't improved. So you take another injection at 5:30, and then the effect of the first lot of insulin is still in the body while the second lot of insulin is working. Stacking your insulin can cause blood sugars to drop down unexpectedly because you've got an awful lot of insulin going on there. There's a couple of different things there, but again, as with the other question, get in touch with your diabetes your practice nurse, and hope those couple of points might be just something for you to look at, but still speak to somebody.
Great, thank you, Dan. I'm going to take a question live that has been asked while we've been on live, and this person's asked, I'm a newly diagnosed type 1 LADA. I'm on mixed insulin twice a day. Do you feel that the basal or bolus allows more flexibility and fewer hypos than I'm currently having?
Oh, wonderful question. Again, a couple of things. Thank you very much for getting in touch with us. And I'm sorry to hear about your diagnosis, but hopefully our information that we have and knowing that we are here to support you might make things a little bit easier for you. As a diabetes specialist nurse, one of our best skills, I think, is fitting diabetes into your life. Now, if you lead a lifestyle that means having twice a day insulin is a really perfect kind of insulin to have, then that is the best regime for you. In terms of basal bolus, the basal bolus, for those that may not be aware, is having a couple of different types of insulin and having one lot of insulin with your food and one lot of insulin for your background insulin, as we call it, your basal insulin. Now, that has shown that you can have less hypos than having a twice a day insulin. But again, if you have a lifestyle or a regime that you follow every single day, that might not be the best regime to have. So I would really urge you to look at the kinds of foods that you're eating. Are they appropriate for the twice a day insulin regime? Twice a day insulin means that once it's in your system, as with all insulins, but when your twice a day insulin is given in the morning, it's still in your body late afternoon. So anything that you're doing has to remember the fact that you took that first dose. A basal bolus does have a little bit more flexibility, but again, if your lifestyle, if the diabetes nurse has said to you, like you do very, very regular patternistic, if that's a word, lifestyle, then twice a day insulin might be the best for you. Equally, if you're very new to having diabetes, so you said that you were newly diagnosed, and I'm not sure how long for, but if you're very new, having 2 injections a day could just be the way of starting to get you used to having insulin. Many of us that were diagnosed many, many years ago, so myself 28 years ago, I started on twice a day insulin because that was the only thing we had. And then we evolved insulins and finally got into a basal bolus kind of world. So it's really very dependent on yourself. Yes, the evidence is there that basal bolus might be more flexible and you may have less hypos, but with some of the modern biphasic insulins, they called, or mixed insulins, that may not be the case. I hope that answers.
Here's a question we've had come through live. Is there a difference in risk between, in terms of coronavirus, for people with type 1 and people with type 2 diabetes?
Yeah, good question. Again, from the evidence that we've been seeing, or from the report, and so we're using the term evidence, if you'll allow. And this isn't really from the highest end type of evidence. We would look at a randomized control trial. Now, given the fact we've only had this virus, this infection in the world for the past 5 or so months, there isn't any real major studies on this. So it's a lot more about reporting and experiences. So from our experience, from the evidence of those that have studied this, there isn't a massive difference between the different types. Whilst the different types, type 1 and type 2, will give you, it will look slightly different if you were to get coronavirus symptoms. So your blood sugars may go incredibly high if you've got type 1, and it may only go a little bit high, if I can say that, if you've got 2. That isn't actually the independent factor. So everybody will have very, very different experiences if they get coronavirus symptoms. But the risk overall for people with diabetes, and I use the term diabetes as the umbrella term for all types of diabetes, is relatively the same. And so that's why we are using, alongside the NHS and the government advice, it seems that we are classing everybody in the same category, which we don't always do, but for the benefit of looking at the risk for coronavirus, that's been a helpful tool so that all people with diabetes have got a similar risk. Now, that is again a bit more independent, and when you speak to your GP or your practice nurse, your diabetes team, they say your diabetes makes you more at risk, and that might be various different things. Your diabetes might not be particularly easy to manage at the minute, and so you've had a little bit of difficulty, which might make you more at risk of all infections, not just coronavirus.
Thank you, Dan. We've had one from Lisa. She's said that she was diagnosed with type 2 3 months ago and as yet isn't on any medication as trying to manage this with diet and exercise. But she said that she's really struggling to lose weight and she's supposed to be having her 3 monthly blood tests on the 30th and she's worried that she may have to go on medication. She's also said that she's worried she might be able to get to her appointment on the 30th because, we might be remaining in lockdown and appointments might be being moved or postponed. What advice might you have for Lisa?
Okay, thanks very much, Lisa. So, Charlie, just clarify, how long has Lisa had been diagnosed for?
3 months ago.
3 months ago. So first, Lisa, welcome to the diabetes world, Lisa, and thanks for getting in touch with us. It's been 3 months. Okay, so do yourself a little bit of love. You've had a diagnosis, which is a horrible thing, and it's a bit scary, and there's a lot of information around there. So 3 months is still a relatively short space of time. It's wonderful that you've been trying to lose weight, but everybody knows that losing weight is much harder than it is gaining weight. So don't expect fantastic things overnight. There's loads of information about kinds of foods that we should be eating and how to keep healthy in terms of food and exercise on our website. So I really, really hope that you're using that and it's being some help. Our first thing about the medications. It's medications, although people may not want medications, and I can understand why, medications aren't a bad thing. It's not that you failed at doing something, far from it. It just means that your diabetes is at a point that needs a little bit of an extra hand. Often people that start medications, whether that's tablets or injections, they reflect back and say how they didn't realize how bad that they were feeling, how tired they were, and how they had no energy. And since starting medication, they've noticed that that's been a big improvement. So let's look at this as not being a bad thing if you have to. There is lots and lots that we can do in this kind of environment. Getting physically active can be difficult, but physically active is a really, really great way of not only controlling blood sugars for type 2 diabetes in a more natural way, but also helping with your weight management. We've got loads of information about how to be active indoors on our website, so have a little look at that, if that's okay, Lisa. The other thing is that you're right. You may not be able to get to your 3-month appointment. That's because your GP may have closed or just closed its doors to people coming in. Don't worry. Okay, it's an extension. Don't see it that your GP is closing down its service. It just means that at the minute you won't be able to get to it. Now these will be picked up. We won't. The NHS won't be leaving people high and dry thinking, well, what have I got to do? They will be getting in touch with you. It just might be a little bit longer. And you continue to do what you're doing because it definitely sounds like you're doing the right thing. Losing weight is a struggle. It absolutely is for everybody. So keep on what you're doing. Try not to think too much about the fear of going on to medication because that in itself will cause you to stress hormones, which will potentially increase your weight or not make it easier to lose weight. So try not to worry too much about those. It's part of having diabetes. And when things get back to normal out in the real world, then you can start looking at other services that might help you to lose weight.
Great, thank you. Thanks, Lisa, for sending your question in. We've had a couple of questions, a few questions actually, on food generally, sent in before we came on live this afternoon. Someone has had another question in a similar vein, Dan, saying that they've recently been diagnosed, but they weren't sure what foods they should be eating or whether they should be following a specific diet. What might you say to that?
Yeah, long ago, we used to have a diabetic diet, and people were advised to follow a particular diet if they have that isn't really the case anymore. And I know a lot of people might say, well, I do this and I do that, and that's fantastic. Whatever you do that helps with your nutrition, you keep on doing that. We don't have a preferred regime or a preferred diet. So low carb, low fat, the Mediterranean diet, the paleo diet, there is so much out there. Just the healthy eating is what we really want to have. So whether your healthy eating means that you don't eat carbohydrates after 6 o'clock at night or something, if that's working for you, that's fantastic. And we would really encourage you to carry on doing whatever's working for you. One problem might be going and getting too much information about lots of trying to mix them all up. And we know that a lot of diets or um, nutrition regimes, they don't work because they're very, very hard to sustain. So it's about knowing you. Me and my brother, we would not be able to follow a low carb diet at all. We like our carbohydrates, so we wouldn't be able to do that. You be able to have a low carb diet. The other thing is that there's not really a big definition about what a low carb diet is. So many places will advertise something that is low carb, but actually not be. So get to know your nutritional labels, have a look on the back of packs, and learn to understand the kind of things that's in your food. And we've got a lot of services at Diabetes UK that can help you do that, from the information on our website, as well as our learning zone, where you can get some tailored information specifically about you and that you have. I would say initially, for the person that's asked the question, get on the kind of foods that you eat. Keeping a food diary is really helpful as well. So you write down everything that you're eating, and then you can reflect on it as well, and say, oh, I've had this today, so I won't have it tomorrow, and so on. And jump on our Enjoy Food web pages, which has got loads and loads and loads of really good recipes and extra information about the kind of foods that's on there.
Great stuff. Thank you, Dan. We've had another question come through. This is quite a specific one, come through live. So the person said, I'm a type 1 and I'm on, and you're going to have to forgive me for my pronunciation here, empagliflozin. Empagliflozin?
Brilliant. Yep.
Brilliant.
Yep. Very good. Very good. What a job in my team, Charlie.
I'm all right. Recent research suggests that I should stop taking the Empag for now. Is that the case?
Very, very good question. Really topical question. Yeah. So an empagliflozin is better than I did there. So sorry. Is part of a class of medication called an SGLT2 inhibitor. Now, these are very recent drugs that we've been giving as an adjunct alongside insulin for people with type 1 diabetes. So I'm going to specifically talk about type 1 to begin with, if that's okay. These have been shown to help people lose weight and to help control blood glucose, which is fantastic. That's a really good thing to have. The unfortunate thing about them, though, is that they have been shown in very, very, very many studies, lots of case histories, is that they mask having very high blood sugars if you were to develop DKA. DKA being the acute complication of having very high blood sugars and or not enough in your system. So at the minute, whilst we know there is a virus out there, that if you get it, you may not have any symptoms, and it may be causing blood sugars to rise, and you may develop DKA whilst having a tablet that masks one of the signs of DKA. We know that it's not a very good idea to be taking it. And so we and our colleagues in the NHS and our colleagues at the clinical diabetologists have looked into it and think it is for the safest option for people who take an SGLT2 inhibitor and have type 1 to stop it at the minute. Those effects of having better diabetes control and losing weight are a long-term effect. So you have to take it for quite some time. And while we go through this pandemic, it's hopefully a short-term thing. So to stop it will be in the best interest. It doesn't cause the DKA, but it can mask the DKA, and we really don't want that to happen at the minute. At any time, at the minute, it's a bit more risky. For people with type 2 who take an SGLT2 inhibitor, for them that might be the absolute mainstay of their diabetes control. And so stopping that and not having something else in your system might cause sugars to go very high, in which case make people a bit unwell and may need to go to hospital. We don't want that to happen. And it might make people unwell and develop coronavirus symptoms. Again, we don't want that to happen. And the risk of DKA is a lot less in people with type 2. It's not an impossibility, but it's a lot less. So we, alongside, as I said, the NHS and the ABCD, are agreement that people with type 1 should stop taking these tablets. People with type 2 can continue. You are an individual, and if you discuss with your doctor that you want to carry on, just understand the risks and understand the various things that you need to do. So speak to your GP about this, or speak to your diabetes team, and they'll be able to give you a little bit more personalised advice. Thanks.
Thanks, Dan. Helen's asked, well, Helen said her son has a scheduled clinic appointment over the phone, and they've told her that they might try to get a HbA1c test out to them. How would this work?
Oh, difficult over the phone. Really difficult over the phones. There's a few different ways that we know about. I don't know, Helen, where your family are based, or who your diabetes teams are or anything, but we're aware of the Royal College of Paediatric and Children's Health recently shared a document that shows how diabetes care is being continued in paediatric services. And it really is. I am a complete diabetes nerd, but it's a real joy to read, because during this horrendous time, children and young people with diabetes are still getting really, really good care. So the phone services, the Skype calls, WhatsApp messaging and WhatsApp video calls are really, really useful to have that review with the clinician. The tricky thing is, how do we take blood? Well, we know that there's a few different services that are available. HbA1cs can be done by finger pricks in some areas that have the ability to do that. So don't be often saying, I want my finger pricks done for HbA1c. It's very dependent on where you are. But one place I was reading about the other day was that they do a drive-through HbA1c clinic, so that the doctors and nurses or healthcare assistants will come out, take a finger prick, and do your HbA1c for you through the car window. How that works for you, Helen, and your family, I'm not sure. Have faith that if they've got an idea, it will be very low risk of entering hospital premises when you don't really need to, or having contact. It will continue to keep the social distancing rules, but they will be able to do it.
Thanks, Dan. We've been asked, what are the rules for someone if they have pre-diabetes? And I assume they mean in terms of the rules, in terms of self-isolation and so on.
Okay, yeah. So pre-diabetes is the term that's kind of used around to talk about people that are very much at risk of developing type 2 diabetes. And so the pre-diabetes hasn't been, people at risk of diabetes haven't particularly been included with the same risk stratification as people with a diagnosis of diabetes. And that's similar for people that are in remission of type 2 diabetes. But I'll stick with the pre-diabetes first. It really can depend on anything else that's going on with your body. Everybody in the country is advised that they should socially distance. People with diabetes are told to stringently socially distance. Where does that come on with pre-diabetes? Still need to socially distance. If you have got high blood pressure, that will also potentially increase your risk. And if you have pre-diabetes and high blood pressure, then your blood pressure will tick the box of saying that you need to stringently socially distance. Likewise is your weight. So people who have obesity are also in that high risk, so they need to stringently socially distance. If your pre-diabetes is related to having obesity, then that ticks the box for you to be stringently socially distancing. Again, everybody should be socially distancing. So the rules aren't different for you if you've got high risk of type 2 diabetes. You might need to do things a little bit more if you were to get the diagnosis of diabetes. But if you were a family member of mine, I would probably urge you to stringently socially distance. But I think that everybody needs to be, at the minute, to be stringently socially distancing as well. Anyway, so that might not be really a question, I'm afraid, but hopefully it's giving you a bit of food for thought.
Thanks, Dan. A few of you have been asking live, and I know a few people got in touch over the weekend to ask about what they should be doing in terms of access to food. And there's a couple of sort of ways that, there's a couple of challenges that we know you're experiencing, whether that's not being able to get delivery and you don't want to leave the house, or not being able to, not knowing what the process is in terms of accessing food if you don't feel comfortable leaving the house to go to the supermarket, or if you're in the shielding group. Or if you're not in the shielding group and don't want to leave your home. We are hearing you, and we really do understand this is something a lot of you are concerned about. We know that you're experiencing challenges in accessing food at all, or accessing the right foods, and the impact that might be having on managing your diabetes. If you are experiencing difficulties, what we would really ask you to do is, there's a form on our website, which you can find a link to if you go to www.diabetes.org.uk/coronavirus, and tell us about the challenges that you're experiencing. If you fill in this form and let us know what's happening, we can take your concerns directly, not only to government, but also to the retail industry. And then we can make recommendations on what we hope can be done to support you more. So please do fill in the form. Please do let us know the challenges that you're experiencing so that we can speak up for you on your behalf. We'll put a link to the form on the live chat at the end of this, so you can see where to go. But we'd be really grateful if you could share your views with us, so that we can support you as best as we possibly can. There's a couple more questions coming through. So this is one from Lo, who says, I'm in my 3rd trimester and my insulin has increased exponentially. After birth, is it usual that my insulin ratio will go back to what it was before?
Yeah, good question, Lo. Thank you very much. So in your 3rd, just to make sure that I heard that right, Charlie, in the 3rd trimester, the insulin requirements have gone massive.
Yes.
Yep, grand. And the question is it going to go back to normal?
Yes.
So I'm presuming then, Lo, had diabetes before you got pregnant. I'll answer it as if you have. If that is different, gestational diabetes, then just give us a little message somewhere down there, and I'll recorrect it. So in type 1 diabetes, when you have when anyone's pregnant, the body gets a little bit insulin resistant, whether you've got diabetes or not. It then gets a little bit bigger in some people who don't have diabetes, and that, to all intents and purposes, develops gestational diabetes. With type 1 diabetes, having insulin resistant means that you will require bigger doses. Now, I don't want to sound rude here, Lo, but imagine in your 3rd trimester, you are getting bigger anyway. And so insulin requirement, as well as taking into consideration insulin resistance, it does go on body weight. So if you are trying to fit this in, if you're this, you need this much insulin. If you're this big, you need this much insulin. So it's absolutely normal in a 3rd trimester for someone with type 1 diabetes to require much bigger doses of insulin. Do they go back to normal? Absolutely. Yes, they do. Simple answer there, really, isn't it? They do go back to normal. Yeah. In the same way that your body will. Your body, won't happen immediately straight overnight. You might need to reduce it and reduce it and reduce it until you go back to your original doses. And you may not even go back to your original doses. Insulin doses are variable. In insulin ratios variable right throughout your life. So worried if you think, oh, I'm on different ratios than I was 9 months ago. It might be slightly different. Try not to worry too. Your insulin requirements as well, if you are breastfeeding, will also be slightly different as well. So speak to your diabetes midwife about that. But to answer your question, yeah, things will go back to normal.
Thanks, Dan. James said, I have type 1 and I've had symptoms for 10 days. I assume symptoms of coronavirus. I was told to self-isolate for 7 days and then I'd be fine to go out, but my symptoms haven't changed. What should I do?
Okay. Great question. So symptoms, not had a confirmed diagnosis. Doesn't say he's got, and it's James. Yep. James, great. Thank you. So you've done the absolute right things, first of all, that you have self-isolated, and hopefully you reduced that face-to-face contact, or you eliminated the face-to-face contact with anybody else. And I hope that you've been getting a lot of support to do that. I hope you haven't been too unwell. You may have noticed that your blood sugars either were going high or they may have even been going a little bit low. There isn't anything to suggest that having coronavirus means that you will have a prolonged coronavirus episode because of diabetes. But the thing that's making me think that I would like to, what I want to tell you is your blood sugar. You haven't been well and you're still not very well. That's relatively normal for any infection. So test your blood sugars, test your ketones if you can, test your ketone level, and speak to your diabetes team about taking corrective doses. If you are very unwell and you feel like you're either vomiting or you're very lethargic, either and your blood sugars are normal or not, then go to A&E. This potentially is something that needs to be seen in A&E. If you were to phone an ambulance, you would tell them that you've got symptoms, and if you go up at A&E, you would need to tell them that you've got symptoms of coronavirus as well. Now, I'm not trying to worry you here at all, James, and you know you better than I do. If you feel like you are very unwell, test your blood sugars, test your keto, keep drinking fluid, try not to get dehydrated. If you can't keep anything down, hospital, you might need to speak to your GP about taking corrective doses. When we're not very well, having type 1 diabetes, our body becomes a little bit resistant to the insulin doses. So having slightly larger corrective doses of your fast-acting insulin and you are following that means that you might need a little bit extra to compensate. We also know that corrective doses, when blood sugars are high, corrective doses, ironically enough, aren't as effective as when they are not as high. So really testing your blood sugars, drink plenty of fluids, test your ketones. Really, really important. And all of this, even if things diabetes-wise are absolutely fine, keep looking after yourself in the way that you have been doing. And if you're really worried, phone your GP and get some. Good luck.
Thanks, Dan. So Nicola has asked, are people with diabetes recovering? And is it possible to share some positive stories of people's experience of diabetes and coronavirus?
Yeah, absolutely. Great question, Nicola. Yeah, we all are hearing lots and lots of bad things about coronavirus. We usually hear particularly bad things about diabetes and coronavirus thrown in the mix. People might be starting to feel like, well, it's really hard work, and it absolutely is. But there is very, very much an awful lot of positive news out there. So people with diabetes are recovering from having diabetes. They're having diabetes and coronavirus and recovering and going back to usual normal lifestyle. There was a person on social media who I think was a BBC reporter, and he self-isolated because he has symptoms and he has type 1. Within 7 days, his symptoms were gone and his diabetes was normal control. So this is really good stories. We are, Diabetes UK, are reaching out to people to ask them to get in touch with us so that we can share the great news as well, that people with diabetes are also getting through this. People with diabetes are also part of the general population too. So when we hear that good stories about the general population, we can attribute that to our lives as well. Charlie might want to say something about getting in touch with us for good news stories.
So yeah, there are loads of ways that you can get in touch with us. It's also worth saying that there's huge numbers of people living with diabetes who are sharing their experiences on our forum. So please do check that out. We'd love that if you had a look and if you want to participate. But also you can get in touch with us to share your story via our website, www.diabetes.uk. We'd really love to hear from you. Not only do we want to hear about the challenges that you might be experiencing with food, as I said, we're really keen to hear about how people with diabetes are sort of just getting through this challenging and difficult situation. How are you coping with lockdown? So what's life like for you at the moment? That can be positive or negative. We'll be thrilled to hear from all of you. If you want to tell us a bit more about your story and you'd be happy for us to share it, please do get in touch. We'll be really glad to hear from you. But as Dan says, people are sort of are getting through it. There's loads of positive stories out there, and you can find huge numbers of them either on our website or on our forum. So please do check that out. I think we've nearly run out of time. So Dan, before I hand over to you for any final words you might have, just a huge thank you to all of you for joining us this afternoon. Thank you for bearing with us with our small technical difficulties at the start. Thank you for sending in all your comments before we came on live. Thank you for continuing to send through your comments and questions while we've been on live. We will do everything we can to come back to you all for any questions we've not managed to touch on today. So please do bear with us. If you need immediate support and just want to talk to us about anything at all, please, our helpline is open, so please do get in touch with us if you need us. You can get in touch with the helpline on 0345 123 2399, and we're open from Monday to Friday between 9 a.m. and 6 p.m, or you can email our helpline team at helpline@diabetes.org.uk. If you're in Scotland, you can get in touch with the helpline there on 0141 212 8710, and that's again open Monday to Friday, 9 a.m. to 6 p.m. All of the contact information can be found on our website if you need it, but please do get in touch if you need us. We're here to help. Dan, I'm going to hand over to you. Any final words?
Yeah, firstly, I want to reiterate what you just said there, Charlie. Thank you all very much for letting us into your life for 45 minutes in this Facebook Live. It's been a pleasure, and I've absolutely loved speaking to you about your diabetes. So thank you very much. I wanted to just point out, though, a lot of people are worried about controlling their diabetes during this time. And I want to remind people something that you all already know. You are all very good at looking after your own diabetes anyway. We know that people with diabetes see health professionals for about 3 hours a year. Now, that might not have occurred during this time, so you would still be looking after your own diabetes. And whilst there is other things going on, that you just need to be really good to yourself about. So give yourself a little bit of self-care, and remember that there's lots and lots of things going on, but you know your diabetes really well, and you are your own diabetes expert. So continue to do the really good work that we do hear about, and get in touch with us if you just need a little bit of a hand with anything, or to just talk to anyone. Charlie mentioned the forum and the helpline, and both are really useful ways. So once again, thank you very much for having me here, and yeah, we'll see you all again, I hope, one day.
Thanks, everyone. Cheers. Thanks for your questions.